Hello, how are you? Today we talk about acute bronchiolitis in infant.
This is a surprise for me. I think that I know this topic well.
I was going to take a walk in the park, but let's talk about bronchiolitis and then we'll take a walk. How often sick children with bronchiolitis are admitted to the intensive care unit?
I know that infants with bronchiolitis accounts for 5-10% of total PICU admissions in the United States.
Fine. How often does infants with RSV bronchiolitis are co-infected with another virus?
1/3 of infants with RSV bronchiolitis are co-infected with other viruses.
Fine. What are the risk factors for children with severe bronchiolitis?
Prematurity, heart disease and chronic lung disease.
Prematurity. Significant heart disease. Chronic lung disease. Neuromuscular disease. Immunocompromised disease. With what risk factor are children with bronchiolitis hospitalized most often in the intensive care unit?
It probably sounds weird, but most children admitted to PICU with bronchiolitis are otherwise generally healthy.
As always, you are right. What do you base your diagnosis of bronchiolitis on?
Bronchiolitis is a clinical diagnosis,
Often defined by age less than 2 years. Tachypnea. Dyspnea. Low respiratory tract symptoms, wheezing, cough and rales. Yes, you are right. The disease can progress to respiratory failure. How often do we see apnea in children at the beginning of bronchiolitis?
often. Apnea occurs in 5% of hospitalized children.
How often do children with severe bronchiolitis require mechanical ventilation?
Only 2-3% of children with severe bronchiolitis, but 30-35% of children with severe bronchiolitis with risk factors require mechanical ventilation.
Do children with severe bronchiolitis need a chest X-ray?
Chest radiographs are not needed in children with mild bronchiolitis, but the radiography shall be reserved for cases of severe bronchiolitis or when the diagnosis is unclear.
Do children with bronchiolitis have electrolyte disturbances?
Children with severe bronchiolitis may be risk for syndrome of inappropriate antidiuretic hormone secretion, hyponatremia.
Well, you did well, and now let's go for a walk.